You are listening to the online Ken Local Peer Support Group meeting recorded Tuesday, 8th of February 2022. Welcome everybody to the first Kent online local peer support group by Retina UK in collaboration with the Kent Association for the Blind. We are joined by Chris Wilsdon, who is the Service Manager for Health and Wellbeing, and we are joined by Hazel Kenny, who is a Senior Rehab and Mobility Officer, who will be speaking in a few moments' time. If anyone would like to say their name and just a little bit where you're from, and if you want to share anything about your sight loss, I will start. So my name is Mark Baxter. I'm the Information and Support Coordinator for Retina UK. I've been in the post for just a little bit over 6 months now. I've got retinitis pigmentosa. I've had that since I was a child, and I live in Crayford in Kent. So would anyone else like to say who they are, where they're from? Don't have to.
Yes.
I'm Gail.
You know, you don't.
Hi, I'm Gail. I live in Erith, and I've also got retinitis. And I was diagnosed when I was 28.
Hi, I'm Steve. I live in Maidstone. I have Usher syndrome, which is basically RP with hearing loss.
I'm Julius Hudson. I live in Sittingbourne. I was diagnosed with RP when I was about 5 years old. We always knew I had a chance. I have X-linked RP, which means it's the males tend to get it and the females tend to pass it on. Yeah, and I've been a member of Retina UK as it is now for a number of years, and hoping for research news as well.
What else we got?
Hi, I'm Lucy. I've lived in Kent all my life. I live in Maidstone. I've got RP and I've also got cataracts at the moment as well. Yeah.
Hello, can you hear me?
Yes, how's that?
This is Linda in.
Hello, Linda.
Hello. I'm the mother of 2 children who both have Usher's too. So they both have retinitis pigmentosa and hearing difficulties. They no longer live at home in Kent, but I wanted to know more about what was available in Kent and generally in as things progress, because I want obviously to be able to help them any which way I can.
Okay, cool. Anyone else like to say who they are, where they're from?
Hello, can I chip in?
Yeah.
Sorry, I have some hearing problems with RP, but I'm Howard Lester. I live in Oxford near Sevenoaks, and I work with Sevenoaks, well, I should say Kent Medway digital services and other things. And basically I have RP, but my genetic condition is FARC, which doesn't sound too pleasant, but basically that's an acronym for all the other things. But my job is to try to make sure that everyone has communications in healthcare, health and social care in the most appropriate format. I work with NHS England on that, and it should be in place, but it's not. But I would like to help people and support people who are on this group, and it's great that this system and this connection is there, and I'm very pleased to be part of it and to be part of our discussions.
Wow, thank you very much for attending.
Hi, good evening, everyone. My name is Devinda from Gravesend. I also have retinitis pigmentosa, work within the sight loss sector, and just here obviously to meet, network, understand local services. Looking forward to the evening.
Excellent.
Alert. Job titler has left the meeting.
Anyone else? No? Okay. I would like to, first of all, introduce Chris Wilsdon, who's the Services Manager for Health and Wellbeing. He's going to speak a little bit about the services that the Kent Association for the Blind, or CAB, can provide, and then he will pass over to Hazel for her discussion and talk in regards to the mobility and rehabilitation services also that the CAB provide. So,
thank you very much, Mark. Good evening, everyone. Lovely to be here, and thanks for having us. And it's great that we've got this group off the ground. We actually were planning this group about 2 years ago, and then something kind of got in the way of actually putting the group on. So it's a great start to relaunch now. And really looking forward to working with Mark and the team and everyone in here to take this group forward. So really looking forward to that. I would just like to say there are a couple of people who, although they have Kent addresses, I believe live in the London Borough of Bexley. So I should just caveat some of what Hazel and I are about to say, that some of these services may not be available to you because your sensory teams come under a different authority. So you're under the London Borough of Bexley. The services I'm going to talk about are for Kent, Medway and Bromley. Some of the ones that I talk about will be available to you, but through different providers. So just so you're aware of that. We were on a Living Well with Sight Loss group and got quite a way in before we realised somebody couldn't access a lot of the services we were talking about. So I just wanted to make sure that everybody's aware of that. And I was also very interested to hear the gentleman talking about the work he's doing with accessible information with NHS England. I'm actually involved in two and a half. One of my staff is involved as well in accessible information standards. I'm working with King's Trust and with the East Kent Hospitals Trust in Canterbury, and we're also working with Maidstone and Tunbridge Wells Trust about accessible information. It's a really important point, an issue at the moment, that people get access to health and social care records in a format that is accessible to them, and we're working very hard with the health trusts to try and make that as simple as possible. It's a really complex issue, actually, as the gentleman I'm sure will attest to. But we're working hard to try and make that better for everyone. So I will talk a little bit about some of the services that KAB offer, and then hand over to Hazel, who's much more well versed in rehabilitation and mobility than I am. So I'll do that shortly. But some of the other services we provide, we're quite for a local sight loss charity. We do have quite a number of services, including the assistive technology. We have workers in each of our main areas who can help people with access technology and that kind of thing. So that's anything from a smartphone to massive CCTVs and software and hardware programs and all that sort of thing, which I mean, all our services are very, very busy at the moment, and but available to people with sight impairments in Kent. So that's a really important one, and I know they do great work, actually, especially during the pandemic, helping people to get online and onto Zoom and things like that to attend some of these groups. So that's one. We have in a lot of the eye clinics across Kent and Medway and Bromley, we have eye clinic liaison officers who are there to provide sort of frontline emotional, practical support, information, advice and guidance to people who are going through an eye clinic process, and that may be very early on. So an early diagnosis perhaps of an eye condition, that may lead to sight loss. It may be people who have been going for some time but have experienced deterioration, sight loss. Basically, any issue that somebody's facing and going through the eye clinic process, they're there to support. It's a very important service for a lot of people at a time that can be quite distressing, upsetting, or just confusing. Actually, trying to get through a hospital system can be quite daunting. So that's what those guys are there for. We cover, I think it's 11 hospitals across Bromley, Sidcup, Medway and the rest of Kent. So it's 3 full-time staff, and they go around different hospitals on different days. The other big service we have is a counselling service, which we started a couple of years ago. A need was identified for people with sight impairment and sight loss to be able to access counselling. So we provide a free counselling service to service users and clients. We have a network of counselling, volunteer counsellors, which numbers about 8 at the moment, all providing services to welcome to our clients and service users, as I say. And that's really taken off. That we started quite small, actually, and obviously until people got to know much about the service, but we're now running into we've got a waiting list, which I never wanted, but in a way it's a good thing because people are accessing the service, but it's very, very busy, and the need is obviously there, and it's great that we can fund that, and that's free. It's a free service to anyone who accesses that. We have also a training department, so we can run bespoke training services. We run, in conjunction with the Open College Network, training courses on hearing impairment, sight impairment, and deaf blindness. We also deliver other bespoke training to organisations up and down the county and beyond. We're doing some work with ECLO, the trust, East Kent Trust at the moment, in regard to their accessible information and training, beginning to train staff on how to address people and what to look out for if somebody with access needs comes and approaches their reception staff. So that's really, really positive. And the last one I'm going to talk about is Guide Communicator service, which is for people with dual sensory impairment. And that's generally a paid service, but can be accessed through direct payments, I think, Hazel, is that right?
Yeah, sometimes, yeah.
I'm trying desperately to remember. And they also work with, they have an intervener service for people with multiple disabilities, and a site support service for people who just need a bit of help with, could be post or a bit of shopping, just arranging the house and that kind of thing. So a whole range of services, but our real core, I think, is rehabilitation and mobility. And we're funded, we have contracts with Kent County Council, Medway Council and Bromley Council to deliver the services that Hazel's going to tell you about shortly. So that's our real kind of bread and butter, and that's how we started. So I'm going to hand over to Hazel. When Hazel's finished, we're both happy to take any questions you may have. Okay, so Hazel.
Lovely, thank you, Chris. Hello, everyone. Lovely to be here with you, and thank you to Mark for getting this up and running. As he's already said, I'm a rehab worker, and I'm actually based in Canterbury, but there are lots of people like me covering different areas around Kent. I tend to see people in Herne Bay, Whitstable, Canterbury. Sometimes I do a little bit of Thanet. It all depends where the need is and what the waiting lists are like, really. As Chris has already said, we are extremely busy at the moment. Unfortunately, COVID had a knock-on effect, which is keeping us on our toes, trying to catch up a little bit, but we are back out there seeing people again. So as a rehab worker, what my job is really to help people to learn to do things in a perhaps in a slightly different way to allow them to continue being as independent as they can be. That doesn't mean I come out and I'm going to do your washing and I'm going to do your cooking and read all your paperwork for you. What I am going to do is come out and help you to do those things for yourself in a safe way. I'm never going to come out and tell you you've got to do all the washing and the cooking and that sort of thing. But if it's something that you want to be achieving, then that's what I will be doing. I'll be helping you to look at how we can carry on doing things. It all starts with a sensory assessment, which, as Chris said, we do on behalf of Kent County Council. And that's an opportunity for us to have a good chat, for me to find out about you, to find out all the things that concern you, all the things that you find difficult, the things that you want to be doing. And then between us, we can work out how we can move forward. Now, that might be that I teach you to do something in a slightly different way to you've done before. It might be that I can provide little bits of equipment to make something a bit easier for you. It might involve mobility. Now, a lot of the rehab workers are mobility officers as well, which is what I am. So if you're someone that is beginning to struggle to get out and about a little bit on your own, it might be that you benefit from some training in how to do that in a more efficient manner. It might be involve using a cane of some description. So everyone is very different. So that is the purpose of the assessment. We can have a good chat and find out what's important to you and what you would like to do. And then we will work with you to try and achieve those goals. The other thing is, I haven't got the answer to everything that you might want to do, but I can refer on to other services. If you haven't ever been to the low vision clinic, and that might be something that's beneficial to you, then we can refer into those services. Sometimes we make referrals to places like Kent Fire and Rescue to come out and check that your smoke alarms are working and you're safe in that respect. And a lot of us as well are community assessors, which means we might be able to get equipment for you. If you're struggling with things, think of some examples. Some people need grab rails at their front doors, or they might benefit from having a frame around the toilet or something. So that sort of equipment, some of us are able to measure you up and order bits of equipment in that respect to keep you safer at home. We might be looking at things like how you manage your medication and things. Sometimes that gets very difficult when your sight's not so good, trying to sort out all your medication and things. So we might look at strategies for getting that a little bit simpler for you. So we might liaise with perhaps your doctor's surgery to look, or your pharmacy, to look at ways of doing that a bit better for you. Benefits. I'm never going to profess to be an expert in benefits, but I do know something. And if you need support with filling in forms or applying for things that you might be entitled to, then that's the sort of thing that we might be able to assist with. Together with registration. Now, there's a lot of you there that you might already be registered. The official registration register of people with sight loss is actually held by the local authority. So it's held by Kent County Council, but they ask us to look after it on their behalf. So if you're someone that's been registered, you'll have had a document signed at the hospital, your certificate of vision impairment, and that will then get sent to us, and we arrange for you to be placed on the register, and we'll issue documentation to you to prove that you're registered, and then we would talk about any benefits you might be automatically entitled to, and we can help you with applying for some of those as well. As rehab workers, sometimes we run different groups around Kent, depending on what the need is. So some people express an interest in Braille. So occasionally we might run a group on Braille. We might run groups on daily living skills. Sometimes we've done groups in collaboration with guide dogs for people that might be thinking at some point they might want a dog. So we might organise something with guide dogs, and we also signpost people to other organisations. Obviously, you are all in contact with Retina UK, but people with other conditions, we might also signpost them to organisations that would be helpful. Let's have a quick look at my list. I think that's probably everything. I think that's enough to be going on with. Don't want to listen to me all night. I'm sure you've got better things to do. So perhaps, I don't know, if anyone's got any questions that they wanted, Chris or I?
Can I just jump in at that point? Hazel, something you've said has just reminded me of quite a large thing I missed out as well. But KAB also runs a large number of social groups and clubs throughout Kent. We have a network of volunteers and managed by a volunteer coordinator. So there's young people's clubs, there's reading groups, there's coffee mornings, there's an active group in Maidstone who do things like axe throwing and all sorts. So there's generally a group based around interests somewhere in Kent. And so if that's something that's of interest as well, please do get in touch.
You shut the door though.
Hello, Mark.
Hello, yes. Hello there.
This was Howard here.
Hello, Howard.
I'm sorry to butt into everyone, and the one who was to do with accessible information. I thought your presentation, you, Mark, and Hazel, were brilliant. Nice and clear.
Thank you.
Linking up to the accessible information stuff.
Is anyone?
Sorry, the point I want to make is well, I had a meeting this morning with somebody from Kent Social Services who are basically now trying to sort out the things with my sight and hearing problems, and they were brilliant, and they didn't know half of the things you said, but that's not a criticism of them. What we need to do is link things up and together. The point I'm trying to make here is, the point they were making was look after.
We have had 9 Olympic medals in alpine skiing, 7 of which have been won by head skis. Now they are the big dogs in alpine skiing. We're talking McLaren Red Bull of ski racing world.
Oops, we've got some interference there. Oh, there we go. It's gone.
Got an update on the Olympics.
Well, dogs in the Olympics is one thing. But anyway, what I was told was look after yourself until you try to look after everybody else. And I think that's true. And I have an idea of how to do that. But the reason why I'm talking to you...
As you could see him coming through this section, he kept the hands close, the poles are bent.
Gone again.
But the accessible information discussion we had before is partly responsible to me working with NHS England, and that's having accessible information and accessible communications face to face was me working with NHS England, and they are brilliant. And I'm trying to make that work in Kent as well. I've told you I work with the NHS Kent and all the rest of it. But that's the sort of thing we should make sure happens now. The problem I have is that I find things now because of the lockdown very difficult, but everyone else finds things incredibly more difficult than me. I have local neighbours and everyone who are brilliant. I find things difficult and can wing it, but other people don't have anywhere near the support I do. I have brilliant support in my village in Oxford in Kent. But I don't know in the rest of Oxford, I have no idea. So if I want to push the legal or any other case to make the accessible information standard, which I can explain a bit more about if necessary, but I don't know about anyone else having the problems. I don't have information from GPs or anyone else in an accessible format, and yet I was behind the accessible information standard, which NHS England did that. So I suppose to an extent I'm raising who else is in a worse situation, and can we work together to make sure that GPs and hospitals actually do provide information in an accessible format, and do we make sure that people have face-to-face communications in appropriate formats too. That was my mission, and I put it in place, but it's now not there in a way which it was legally required in 2016. The argument is, let me work with you, hopefully with your guys, because I've been involved in it, not to be nasty in your direction because it's not happening, but actually working with you to make it happen properly now.
Yeah, I think.
Can I comment on that, Mark?
Yeah.
Howard, thank you. I think you make some really interesting points actually, and particularly the one about for everyone to look after themselves first. That's so important. All KAB services are geared around the individual rather than as a collective, because as Hazel said, I think at one point what's right for one person isn't necessarily the solution for somebody else. So we work very much with everyone as individuals to find solutions to the difficulties they may be facing. And that includes sending people information in the format that is accessible to them. So if we are aware of the, for our clients and service users of how they would like to receive information, we make sure we send them out in that format. On a wider point, I think it's important that the work I've been doing with the Accessible Information Standard, it's made me realise actually what an enormously difficult problem this whole situation is. So many departments, even within the same hospital, would have different IT systems, some that can cope better with changes in technology and requirements than others. There's the knowledge of the standard, which I think you alluded to is perhaps not as wide as it should be amongst certain groups, and I agree with you. And I think there's an awful lot of work to be done. But what I would say is I'm very encouraged with the work I've done, particularly with Maidstone, with East Kent hospitals. There is a will to change the way people access information. And they're really, I'm on different project boards in these trusts, and I know some of the work going on. And it's really, really encouraging, actually. I have to be honest and say, I think it's going to take a very long time for it to become the norm, but I'm encouraged by the amount of work that's going into
making it. Mark, sorry to butt in, because it's just, I think, very important. This is why I pushed it in the first place. It sounds a simple question, but I don't know if there's a simple answer. It looks to me as if things can be done simply. What's the problem that makes it complicated? Sorry, that's a very simple, smart ass question. But that's the sort of thing that people like me would ask. And if it's actually more complicated than we think, it can be made simpler. what is the complication that makes it so difficult to do simple things for people like us?
In my experience, Howard, if I may, only just because I've been working on this sort of thing, in my experience, the crux of the problem is twofold. One is that many health and social care providers aren't aware of somebody's access needs. That's the first one. And even if they're pointed out to a provider, it's a difficulty in the technology that those providers use in being able to cope with the different demands that people have, and I mean demands in a positive way, about how they access their information, that the systems can't actually cope, is what it comes down to. So you're right, on the face of it, it seems like a very simple question, but what I have learned is that the solutions are very, very complex.
There are many different
solutions are the mechanisms, the IT systems, not the ability to actually provide the information in different formats or face-to-face communications. It's the IT systems that you're seeing. I'm not trying to drop you in it there, and I want to be positive to everyone else, because I have friends and neighbours and GPs who are brilliant, but I want to make the accessible information standard work. Sorry, I'm being a bit pompous there, but you know what I'm trying to say.
Yeah, I agree, and I agree with you, and I'm certainly doing everything I can to help.
Now, does anyone else have any further questions for Hazel or Chris, or would you like to ask me any questions regarding the support services that Retina UK can provide across the UK? We do have other local peer support groups started around the UK as well. We do have a helpline as well, which if you've got any questions regarding inherited sight loss, you can call our helpline on 0300 111 4000, or you can email us at info@retinauk.org.uk if you've got any other questions as well. We do have a talk and support befriending service as well, just in case you would like to speak to somebody like yourself that's got inherited sight loss. All of our helpline volunteers have all got inherited sight loss of one stage or another, so they can appreciate and relate to some of the questions and challenges that you might be facing. So, you know, there are some of the other services that we do provide, and information and support that we can provide you with. We do have, Chris mentioned webinars as well. We have an upcoming webinar. If you're interested in being active and getting out and getting fit, on the 24th of this month at 7 o'clock to 8 o'clock, we are going to be joined by British Blind Sport for that webinar. So jump onto our news and events page and register for that webinar if it's something that you might find interesting. So but if there are any other questions that you would like to ask me or Hazel or Chris, then, you know, please feel free.
It's Davinder, if it's all right, may I jump in?
Yeah, go for it.
Yeah, cheers, thanks for that. And thanks all for the presentations. Just a quick one, because I'm thinking it's from a holistic perspective, and I'd welcome all your views on this. But let's take somebody who might have just acquired sight loss, going through the whole pathway of the NHS, comes from health into social care system, is sitting at home, and we know that technology has moved on. I myself work with teaching people myself on it. I'm just curious, from both a rehab and a financial perspective, what's the current barriers do you find in Kent, that point, the pinch points? I mean, do you think, for example, knowledge is an issue? Is it acquiring, say, adjustments through, let's say, disability facilities grants? Is it, you know, because I'm just trying to think of the individual, and it's such a fractured thing. And it's such a, as you said, Hazel, it's a holistic assessment. I'm just curious in Kent, is there any postcode lotteries? Where are our pinch points at the moment?
Do I answer that one? As part of the rehab assessment, we will be looking at people's needs from the point of view of technology. So if someone wanted to use their computer and they were struggling to do that, then at the bottom of the pile would be me. I'd be showing someone how to use accessibility options on their existing computer. If someone needed additional software, then one of our technology workers would be going out to assess them. And if it was something that needed purchasing, then there are opportunities for us to apply via KCC from a digital technology fund. So it's all about what someone needs, not just what somebody wants. So we would be looking to find out exactly what that person needed. So if perhaps someone with Usher's who's got the dual sensory loss, they might need specialist software to enable them to communicate with other people. So in that case, we would be assessing them and potentially putting in to request technology to meet those needs. But it does come back to what I said earlier. Everyone is very different, so there isn't a stock answer, I'm afraid.
No, it's fine. No, please don't. I hope it didn't come across that way. I'm kind of curious.
No, that's fine. What you find these days, people have got a lot of technology. They stop using it because they think it's not accessible to them anymore. So even people with smartphones, there are a lot of people who don't realise that they can actually speak to their phones without any additional software to make calls and things. So a lot of the time it's just teaching people to use equipment they've already got. And over the years, the technology has just gone from strength to strength. I mean, nowadays you've got Alexas and Google Assistants in people's homes, and they're absolutely fabulous. And then they're mainstream items that a lot of the population are using, not just people with a sight loss. So it's becoming much more accessible these days, I would say.
I'm just curious, and just a supplement question on that. I mean, not so much more the technology support. I'm thinking maybe even more wider, because I've known cases, for example, where somebody's at home, we know they don't want to go into the NHS hospital. The NHS hospital situation might be like, right, what's your home setting like? And you mentioned adaptations. So I'm just curious, when somebody comes into KAB, says, I'm maybe struggling at home, and that could be isolation communication, that's the tech side of it, that's fine. But, just home cooking, rehabilitation classes, picking up their lives. We haven't quite got to sports and leisure yet, but they're just trying to cook a meal and get themselves out in the community and adapt their home suitably. Is that all via yourselves? Is it one avenue, or is it all separate assessments from KCC, or is it all centralized? I'm just a bit curious as to the pathway, really.
It depends really how they come to us. So if somebody has just contacted us or been referred to us because they've got a sight problem, we will go in and look in at all those avenues. And if it's a case of somebody needs help perhaps with their personal care, that's not something that we do. So we would refer directly back to social services and say this person needs a care needs assessment. They will look at that from that side. We would look at some aspects of it, because if someone is struggling to do something connected with their care and it's because of their sight, then we might look at strategies to make something a bit easier. But social services would do the care needs assessment in that respect. It might be that they've been referred to us and they've already been through the KCC pathway, in which case they may already have had equipment put in. They might have perhaps an enablement service going in, or some carers or something. So it could come from different angles. So they could come straight to us, or they could have already been through other people and then get sent to us.
Okay, cool.
Does that help?
So the recommendation, it does. I think the theme I'm taking is have a chat with you guys, and then it kind of then depends on the need, basically. Cheers.
Sorry, this is Howard again, being a pompous kid. But you raised a good point that the technology is speech controlled, which is actually pretty difficult, but it works for lots of other people. So that means that people without sight and hearing problems can actually help people with sight and hearing problems to use that technology. That doesn't happen, but it's the most sensible thing to do. Sorry.
No, it's okay. In fact, Howard, I can tell you that because I train on this stuff. So I'll tell you what my experience tells me. And that is that family and friends, if they have them, that is something I'll caveat, tend not to have the time or patience to do it. So there's a lot of communication issues as well, because as I appreciate, I say it to a lot of people, there's visual language over there, over here, versus to your left, 12 o'clock, 11 o'clock, 3 o'clock. Yes. I'd say facilitating knowledge is not as straightforward, especially with vision impairment, as it is to say to a sighted person, maybe just partake that knowledge. It's the process of which is given.
Yes.
Yeah.
And I think that's true, but then I'm being a bit stupid. There was a program on Michael Rosen does a program, but basically it's about communications.
Sure.
And about a week ago, it was about communication with aliens. And it was how to communicate with sort of people from outer space, but actually Braille is one of those examples and sort of other things. And just say actually communicating at the moment with people with sight and hearing problems, Braille is important. There's now a policy in government to try and get a bill to get sign language. And I only know that by other routes, not because I'm particularly clever, but I think that came through from a private member's bill because Boris Johnson's communications in the early days on the pandemic had no sign language, yet it was there in Scotland, it was there in Wales. So the fact that there is a bill to get sign language accepted as a recognised language in England has come through because of that. That's what I think is going on. But
I think it's going for its second reading soon, Howard.
Right. Thank you. I think the same will come with Braille, but I'm not smart enough to use all this technology or to explain to all of you any more than I'm explaining. You know more than I do. I've just pushed to try and make things simple for people like me because it's sight and hearing problems have been a big problem for me. I can push in all those directions, but I need your help to understand what's going on.
Howard, may I just jump in there for a minute, please? If that's all right. I'm just going to say to you, my oldest client I've taught is 97. Okay, and she shared something to me, and she said it's never about your age; it's about your ability and desire to wish to do something. What I would say to you is this, and I'm even off this group. I'd happily have a chat with you if you wish. I keep things simple, and I'd say to you, Howard, that anything's possible. You just don't do it yet. Okay, so think about. I would say, but you asked the question about knowledge, and I'll link this to your AIS because I did some work with Moorfields and other trusts as well. The thing about it is there is a combination of your question about the system, but there's also a question of choice. And I use the analogy of a tool belt. How many tools have you got in your tool belt to take on any problems that you're going to come across? And the more tools you have, the more choices you have. So I think that the reason I'm saying that, I'll give you an example, Howard. Imagine I walk up into a clinic. They haven't got the, let's say, quote unquote, right situation. Well, I've got a smartphone. If you were enabled and equipped, you have the choice to use an application where you could connect to a volunteer who could offer you sighted assistance. You have the option to use a program that could read the signs. You have the choice to even communicate to family and friends. And there's all sorts of things you can do. But the frustration that happens with any disability isn't the individual, it's the situational disability. So it's having those tools to get over that.
I think that's true. And I think as a group, we should discuss that sort of thing, not only in Kent-wise, but nationally.
Sure.
But the more gadgets you have, the more
Yep.
complicated life becomes. So it's not quite that simple.
It can be overwhelming.
Yes.
Yeah.
But I managed to do a PhD by winging it, doing things with the early stages of website design. They are now far more complicated for me. I did wing it, and I had good support and friendship.
Sure.
It's not quite the same now because websites are far more complicated. They are called gadgets and everything. The sort of way that I got through was by winging it. 20 or 30 years later, it's not so easy for everyone else. And I'm trying to say, it's brilliant, it's wonderful. But I'm not convinced that that's true now, whereas it
Sure.
was 20 or 30 years for me. I'm trying to make sure that universities, schools, and primary schools are as accessible as possible, as accessible as those arguments I'm putting forward, the acceptable information standard in healthcare. I don't.
I get your point, and I still want to let the panel obviously. But what I would say to you is this: it's a combination of the system. I always say about the social model of disability. At the end of the day, we can offer somebody a mobility aid, say a wheelchair user who's absolutely fine. They're getting from A to B, but the moment they come up with stairs, what's the solution?
Yes.
Yeah, it's a ramp, isn't it? So what I do is my teaching. I say a screen reader magnification is our equivalent of a ramp. The question is, have they architecturally designed it in the website? Have they actually architecturally designed it in the physical space? And actually, do we as people, have we been taught the cane skills? Do we know how to use a guide dog? And therefore, do we know how to interact with that environment when it is suitably adapted as well? And those two things must come together.
Yes, I agree. But we mustn't, well, I don't know how to say this, but if we make it, if you say all those sort of things that say are far too complicated, we make it too complicated for anything that actually go forward at all. We have to make the system to allow itself to change to be as simple as the sort of things you're talking about.
Sure.
Has to be simple to make it change. And I don't know what that answer is. But the answer I found 30 years ago was wing it.
I'll tell you, unless you want to drink Red Bull and wing it that way, it's not going to get you very far. But I'll say keep it real. I welcome the panel's view on it as well, because obviously a lot of this can go. I'm always quite a practical individual, and I've always been that way to say, okay, and I'll use because we're just talking about physical skills. I think a big area that we have, and I welcome Rehab's thoughts here as well, which is I don't think people tend to realize that cooking is an achievable skill. Okay, I'm an Indian guy. I cook curries. My mum taught me. Now, it's a visually impaired chap. I'm massive on health, and that's physical as well. We talk about British Blind Sport, the work Retina UK is doing. But people don't realize there's three really key principles: sleep well, move well, eat well. And the barriers for blind and partially sighted, sleep well can be different as long as you don't get melatonin. We understand that. But the other two are the big areas, because people have a struggle to understand maybe that, they're not getting there. I think the stat that the RNIB sees sports differently said is 55% of blind people don't do the minimum half an hour exercise a week. So if you take that and then you say, actually, there's a massive stats around obesity and everything else, I could imagine that not enough people know enough skills around making a decent home cooked food compared to microwave meals. So the principles again are, if you take the problem, what's the solution? That's kind of where I always come at it, because there will be a solution because people do it. And maybe it is peer-to-peer support, but sometimes the arena of that information, Howard, might be a steps. Maybe the person who needs to get in the arena of information that wheelchair user can't get into. That library of information is inaccessible until we put that ramp in.
There are sorry, it's Mark. I'll weigh in. When it comes to cooking, there are websites out there. There are assistive tech companies like Cobalt, for example, Sight and Sound. They do a plethora of all sorts of different talking technology. And in my kitchen, I've got talking weighing scales. I've got a talking measuring jug, you know. And when it comes to cooking, you don't necessarily need sight to be able to do it. What you do is you adapt to survive, and you use the other senses that you've actually got around you, you know. So, you know, obviously for me, for example, I'm blind, so I've still got 4 remaining senses. So I can hear when things ding, I can smell, I can taste, I can feel the texture of something, you know. It's when people turn around and say, I can't do something. Well, the technology is there. And it's the technology's there wherever you go. It's just up to the individual to go out and find that technology and utilize it to the best of their abilities. So, there are things that people can still do, and it goes back to accessibility, you know, and what Howard was saying as well with accessible information. Again, it is there. You've just got to. It seems unfair that the blind person has to jump through hoops to get the information that they need. But if you ring up, I don't know, your internet provider and say, I don't want things sent to me by post because I can't see, what they will do is they'll start sending you all your bills via PDF. So you can use them on a screen reader on your smart device or on your home computer via third-party software. The technology is there. Unfortunately, as a blind person or a disabled person, you have to go and find it. It's not going to land in your lap, no matter how much we want to jump up and down and ask governments and the NHS and everything to provide it for us. We have to do it. But at the end of the day, and I've been told this many a time, we are such a small minority that it's not going to happen. You know, we have to fight for change. We have to fight for adaptability, but we'll get there in the end.
Can I butt in on being Howard again? Sorry, I've been a bit of a pompous git today, but the accessible information standard in health and social care is about providing information in the format you need. In health and social care. Okay, it's not there, but we can argue. But why can't we just apply the same thing for how you look after yourself in your own house? It should be the same thing. And KAB should be the people who you were saying, my good friend, we can't find out what's there. We need it to be spread to us. Well, why don't KAB actually provide information about what works for people with particular sight and hearing problems, and this works and this may work for you? That doesn't happen.
I think the key to something actually I was thinking earlier, Howard and Devinda, I think a really interesting discussion. What I was, as you were talking there, what I was thinking is that a lot of this it's very much about, and I think Hazel would agree here, it's about the individual. It's so easy to I don't know, for anybody, I suppose, to fall into a trap to say there's this kind of technology which visually impaired people should use because it's great. It's not necessarily the case that that's going to work for that person. So we work with people as individuals, as I said earlier, to find out what are the problems, perhaps what are the issues they're having, and so we work with them to try and identify what's the right solution. It's not a one-size-fits-all kind of solution. So it's very individual, and it comes back. Devinda made a great point about friends and family, perhaps not the best technology advisors either, because absolutely, I totally agree with that. Because, oh, you know, Nan, I've got this thing and it talks to you and it's great, and that might not be what Nan wants. And I was chatting earlier to our counsellor, actually. We were just chatting about other things, and one of the things that came up as well, and I think this is a really important point, a lot of this is about timing.
Yeah, I would agree.
So if somebody comes into an eye clinic, for instance, and when I was an ECLO, an eye clinic liaison officer, if I sat down and just assumed they wanted all this help, then I wouldn't be doing my job very well. So it's very much about ascertaining what somebody wants now, what help do they think they need, can we signpost them to the right service now, to let them know what's available for them when they're ready to engage with other services, or rehabilitation or long cane training, which a lot of people will shy away from. So I think there are a number of factors that go into making any service that's provided right for that individual.
Yeah, I would agree with that.
I would agree with that as well. Sorry, it's Steve.
Right, Steve.
I've got some experience of teaching people with tech, and it is very much an individual thing. You can't identify what people will actually use. You can give all the technology in the world, but if they're not motivated to use it, and if they're not prepared to put the time and effort in to learn how to use it properly, then it's never going to work. Conversely, if they are prepared to use it, then very often they'll use something that you would say is inappropriate, you know, or too difficult, and you know, they'll make it work for them. But that's the only way you can do it.
Steve, may I just cut across you? I think one of the things that I always say to people as well, I don't know if you would agree with this as a group, is people don't always know what they don't know. And so unfortunately, if you talk about themes, I'll give you a prime example. If I said to you, have a smartphone, and you think, well, why do I want a flat piece of glass that I can't feel a button? The first thing is a negative association. Whereas if I maybe say to you, let me give a device that will talk to you as you touch the screen, and in fact will read your letters to you. Are you struggling to read your letters? Do you think that'll raise motivation?
Well, I've got a smartphone. There's one here.
Yeah, no, Steve, but my question being, sorry, is
I
you explain that, yeah.
I don't use it as much as I should.
Yes.
But a lot of the things that people say, oh, you could have a smartphone to use for that.
Yeah.
I found other strategies because I don't find using a smartphone very rewarding.
Sure, appreciate it.
The problem is I'm deafblind, so I can't hear it.
So my question going to come back to you is what's your ramp? Do you need hearing aids that are maybe MFI compatible, for example, so that they're made for iPhone, your voiceover goes straight into your hearing canal? It could be, you know, so the question is we need to identify what the problem is before we start going down solution routes. Why, yeah.
I've been down the route. I've got a Bluetooth streamer that fits on my phone.
Sure.
If your hearing's poor, amplification isn't the answer.
Sorry, say that again, Steve. I missed that last one. Sorry. Is it magnification, did you say?
No, I say if your hearing is poor,
sure,
then amplification isn't necessarily the answer.
Okay.
It's a bit like saying to somebody who's blind, you need glasses.
Mm-hmm.
You know, it isn't an answer necessarily. It helps, but it isn't, you know, it still won't make you comfortable listening to things.
Sure. Yeah, no, I appreciate it. And I think that's where,
you know, you need different strategies for different people.
I agree. Yeah.
And some people realistically will never use the I2. You know,
Sure.
they'll find another strategy that they're comfortable with.
Can I ask a very stupid question of the lady who was talking very nicely? I try to speak up.
Sorry to interrupt you, Howard. It's 8:05 now. This meeting is from an hour. I'm sure people may have not had their dinners yet or anything like that. But we can schedule another meeting, and that was going to be my last sort of topic of the evening. This is our first online Kent local peer support group, but we will in the next upcoming months try to take it face to face. So if anybody has any comments or thoughts or feedback in regards to whether they're comfortable about going face to face, Chris and Hazel at the KAB have provided us with a community room that we can actually use during the week, sort of Monday to Friday, 9 till 5, if we wanted to do a face-to-face meeting there for the first one. If you do have any comments or feedback that you want to convey now before we wrap the meeting up, then I'm more than happy to take some comments on board. Or if you would like to drop an email to info@retinauk.org.uk or services@retinauk.org.uk, and pass on your feedbacks after this meeting. I'll be much appreciated to know what you think.
Sure. I'll just say thank you to everyone as well for your time.
Yeah.
Thank you.
No.
Thank you very much.
No worries. I do apologise to interrupt you there, Howard. You're making some you're making some excellent points, but yeah, we're overrun by about 5 minutes now. I'm sure that people have got sort of their.
Thank you for having us at band. It's difficult, brilliant, and much appreciated. And meet other people, albeit online, brilliant. And thank you to all of you.
Yeah,
thank you very much for attending, and thanks to Chris and Hazel for their talks as well. Has anybody got any kind of final questions for Chris, Hazel, or myself? If you don't want to say on screen, then you can always drop me an email or contact the office again on our office number, which is 01280 821 334, if you want to just to call the office and leave a message, and that will get back to me as well. So any comments, queries, feedback regarding this evening, or how you would like to proceed forward, what you would like to talk about, other speakers, what your interests are, and we'll try and set up a face-to-face meeting that is both fun and exciting and informative at the same time.
Good.
Excellent.
Fabulous. All right. Have a good evening, everyone.
No worries. Thank you all for attending. Thanks.
Bye,
Thanks very much, everyone.
Thank you. Thank you for attending. Thanks, Chris. Thank you very much, Hazel.
Very welcome.
Hi, everybody. Thank you.
We hope you have enjoyed this recording. If you have any questions, queries, or wish to leave any feedback, then please leave it in the comment section below. Alternatively, you can send your inquiries to info@retinauk.org.uk. Contact us via the telephone on 01280 821 334 or call our helpline on 0300 111 4000, which is open Monday to Friday 9:30 AM to 9:30 PM. If you would like to know more about our local peer groups, when your next meeting will be held, or if you wish to get involved in creating your own group, or would like to know more about our services that Retina UK provides, then please visit our information and support page on our website www.retinauk.org.uk and navigate to our local peer group page. Thanks again for listening. We hope to see you again soon. Take care and bye for now.